Polycystic ovary syndrome, commonly called PCOS, is one of the most common hormonal conditions affecting women of reproductive age. But despite how common it is still widely misunderstood. For many years, PCOS was thought of mainly as a problem of the ovaries, especially because of the name itself. The term polycystic made it sound like women had multiple cysts on their ovaries that were the main cause of the condition. But modern research and updated clinical guidelines now show that this is not the full picture. In fact, many people diagnosed with PCOS do not even have visible ovarian cysts on ultrasound. That has led experts to refine how the condition is defined. Today, PCOS is better understood as a complex hormonal and metabolic disorder involving multiple systems in the body, not just the ovaries. At the center of PCOS is usually a disruption in hormones such as androgens, which are sometimes called male hormones but are present in all women, insulin, which affects how the body processes sugar and fat, and reproductive hormones like LH and FSH, which regulate ovulation. Because of these imbalances, PCOS can show up in very different ways from person to person. Some of the most common symptoms include irregular or missed periods due to lack of regular ovulation, difficulty conceiving or delayed ovulation, acne, oily skin, or excess facial/body hair from elevated androgens, weight gain or difficulty losing weight, often linked to insulin resistance, darkened skin patches, especially around the neck or underarms. What is also important in newer research is that PCOS is not only a reproductive condition, it is now strongly linked with metabolic health, meaning it can increase the risk of insulin resistance, type 2 diabetes, and long-term cardiovascular issues if not properly managed. There is also increasing recognition of the mental health impact, including higher rates of anxiety, depression, and body image stress in many patients. Instead of thinking of PCOS as just a fertility problem or a period problem, it's now understood as a whole body hormonal condition that needs early recognition and long-term management. Key message from recent medical guidelines is this: PCOS, now renamed as PMOS, is not just about the ovaries and not just about fertility. It is a lifelong condition that affects hormones, metabolism, and overall well-being. Early understanding makes a big difference in how it is managed.